welcome everyone to SPEEDCON 2020 and to the Speed TV of SPEEDCON. Today we have this SPEEDCON TV getting recorded in Hotel Leela Ambience Mall in Gurugram, and today we have with us Dr. Lakhani, who is consultant endocrinologist and diabetologist at Zydus Hospital, Ahmedabad. As you might have seen in the agenda, he is going to speak on alternative medicine and diabetes management. So let us hear from him his views on this topic. So Dr. Lakhani, what are your views on the promotion of alternative medicine for diabetes mellitus? Because every day we are looking at ads on TV and newspaper about this.
Right. So first and foremost, I'd like to welcome everybody to this beautiful day for academics. And like you rightly said, my topic tomorrow is talking on alternative medicines and diabetes, and the entire topic is actually time to burst the bubble, right? So I think we see a lot of bizarre ads for alternative therapies, not just medicines, all kinds of alternative therapies for diabetes management. There are two problems I have with that.
Right, sir.
One, the first problem I have is that, do we have any evidence for any of these, right?
Correct.
So we all move by science, and science tells us that you need evidence to prove anything, right? Now, let's say I develop my own diabetes medicine tomorrow, right?
Right.
Unfortunately, I'll be able to promote it because there are very lax laws in our country. But does it really work, right? The money which you spend for buying that, does it really work for the patient? The second problem is what is known as opportunity cost, right? Which economics, and today we are having the budget as well. So when you talk about economics, and there is something known as opportunity cost.
Very true.
So if I take XYZ medicine which has not been proven form of therapy, I'm not taking a form of therapy, which is a proven form of therapy. So that unfortunately the patient has a double problem. So one, you are taking something which may be potentially harmful, you don't know. On the other hand, the one which is approved, you're missing out on that, right? So that's a big problem. And I think in today's world, unfortunately, there are laws for pharmaceutical companies, there are laws for promotion of anything. But for alternative medicines, unfortunately, we don't have any laws. And that's why these, they are frequently marketed, you see ads, you see online ads on this, and that becomes a big problem in our country. So it's a big menace. I think future, there are just two ways that either the government, forces them to do clinical trials and prove what they're claiming.
Efficacy and
right, or we stop it altogether, right? That's the two things.
But doctor, this is happening, and this is happening every day. People are buying, they're spending money. So are there some flaws in human behavior that makes this marketing possible, and patients are exploited?
Yes, absolutely. So there are there is something known as a cognitive bias, right? So there's a very famous psychologist who's Nobel Prize winning. He has written a book, Think Fast and Slow. Is known as
Fast and Slow.
Yeah, so his name is Kahneman, and he's a Nobel Prize winning psychologist.
Right.
So he has done a lot of work in this sphere of cognitive bias. So human behavior, our thinking, they are influenced by a lot of biases which we have, right? And there is something we all have, which is known as we all have known as something known as blind spot bias. So we don't know our bias. We don't know what influences our decisions, right? So in general, public have of different forms of cognitive bias, and the problem is that people who market these products, they are very well aware about these flaws.
These flaws and these behavior problems.
So they try to exploit. Now, when you have a problem, there are two ways. Either you can help the person get rid of the problem, or you can exploit that for your own benefit. And that's the unfortunate part.
Because he's looking for a solution.
So what happens is that, for example, patients are constantly hear the word herbal and natural and all that, right? Bought from the foothills of Himalayas, right? So patients get attracted to these terminologies because there is a bias that since their childhood they have been told that if it comes from Ganga or if it comes from Himalayas, it is pure, it is pristine, right? So harmless. These harmless, right? So these are words which come potential magical properties, right? So they have already been primed for that, right? And once they see these ads, they get attracted to that because there's a cognitive bias which they have, which attracts them to these products. And again, like I said, A, we don't know whether they work or not, but B, there's an opportunity cost, right? That these patients who could be on normal good medicines which have been proven, Instead, they're taking something which may be really harmful. So that's the problem, right?
So on one hand, they are missing on the benefit.
Yeah.
On the other hand, they are also at the risk of damages.
Correct, absolutely. And see, the problem is this is not like there is a difference between acute disorders and chronic disorders, right? For example, let's say I'm taking a medicine which is not working.
Right.
I would not know that for many years, right? It will take me a long time to really realize that, what I'm taking is probably harmful or not working. For example, अगर आपको fever होता है, if you take a herbal medicine, right, and it doesn't work, then you will take a paracetamol, right? Because you know that a fever to utra nahi, I'll take the medicine which works. So that's
there it is proven.
There and there it's proven, right? So that's the problem. So that's why these medicines tend to work in chronic disorders like arthritis and diabetes and coronary artery disease and all that. So because they have a long duration of
a lot of time to develop the complication, and till the time patient is exploited.
Already
all microvascular complication will take a lot of time, doctor. But doctor, is there a benefit? Is there a evidence of any of these medicines actually working for the patients?
So, very interestingly, there are institutes in our country which are working on generating evidence for that, right?
Right. So, like at CDRI, we have.
Yes. So we have certain, drug discovery process and all that, for alternative medicines. So there is a process which goes on, but unfortunately, and so far, whatever evidence I could dig up,
yes,
the evidence is extremely insufficient to prove anything, right? For example, there is a drug. I will not name the drug. I'll name it in my lecture tomorrow, but not on the TV. There is a drug which and our beloved Prime Minister was also promoting that medicine for diabetes. It's developed by one of the government institutes.
Okay.
So this drug and there's a lot of promotion which goes on. How many patients were enrolled in a study? They have one study. They have one clinical study, right? Compared to the number of studies you have for any drug, any metformin, SU, whatever, right? Be hundreds of studies. This is one study. That one study has 64 patients, just 64 patients, right? And of that, only 32 were receiving placebo and 32 were receiving the medication. Now, you tell me, is a drug which has been tested on just 32 patients, just on 32 patients across a billion population, will it be applicable or beneficial for a billion population? I don't think
you cannot scale up. You cannot scale up,
right? So that's the problem. So what I would say is, instead of spending money on marketing,
right,
why don't they spend money on doing better research? Why don't they do a research on thousands of patients, right? And say, why don't they do research on already existing medicines?
Correct.
And proving that the new medicine is probably better, right? Because this is how scientific development happens, right? So spend money on good randomized control trial, involve more patients, and then if it really works, we are all happy to use it. But the problem is that it cannot be that these patients mein maine dawai stress ki, and I say that it is a Ramband for diabetes. No, it's not.
Those are tall claims,
right? Which may not be substantial.
Because this is happening, sir, and people say that alternative medicine treat the disease from the root,
right,
which is not possible with the modern medicine. And this is a very common
yes,
thing going
this is a common misconception. This is a common cognitive bias, right? Very bizarre, because it is exactly the opposite. Okay. So sometimes to prove something wrong, you actually take a stand which is exactly opposite of what it is, and the people get so confused that they don't really, if you talk about treating from the root, now if you take the modern medicines like SGLT2 inhibitors, or if you take GLP analogs, right, they actually produce weight loss. They actually reduce insulin resistance. They, metformin, we know for so long that it reduces insulin resistance. That is one of the major pathophysiology of type 2 diabetes, right? So clearly we see, we prescribe these drugs every day, and people lose 2 kgs, 3 kgs in a month.
Correct.
Naturally, the patient's insulin resistance is going down, the patient's metabolism is improving. Modern medicine actually treat the disease from the root. Because they actually understand the disease process, right? That's the difference. Whereas you take these medicines which you don't know how it works. Even the people who have made the drug, some people say it's a natural DPP4 inhibitor, some people say it's like sulfonylurea. I mean, first, so aap hi samjho ke how does the medicine work, right?
Mode of actions are not known, sir.
That's not known. And just because it's herbal and just because it's been taken from natural ingredients, does it really mean that it's going to work? We don't know. Even to say that that for that matter, SGLT2 inhibitors has been developed from a bark of an apple tree, right? So even that is natural in that sense. For that argument, that is natural, right? Now, but I would not eat a bark of an apple tree because
treat my disease,
right? So rather I take the component which is the important one and then use that for the
Which is
disease.
proven one, which is tried and tested in the clinical trials and everything. Right, sir, I understand that. So, sir, how does a clinical trial deal with a patient who requests information on alternative medicine for diabetes?
Okay, so clinicians, I would say, what they should do is, they should say that, you should say that I am not an expert in this. That is the first thing you should say, right? Now, I cannot give advice on alternative medicines because I am not trained to deal with alternative medicines, right? B, I can say that we can, look at the information which is available, right? Look at the data available. Then it's up to you whether you're convinced with that or not, right? So I will say that, according to my information, there is just one study with 32 patients, versus modern medicines have thousands of studies with thousands of patients. It's your choice to choose, whether you want to choose a medicine which has been proven only in 30 patients versus a medicine which has been proven in thousands of patients, right? And ultimately, we also need to inform people that what their cognitive biases are and how it is being exploited by these people, right? So, you make them understand that, if it says it's natural doesn't really mean that it's always safe. The worst of the poisons which are known are all natural poisons.
Natural
right?
poison. For example, arsenic.
So natural doesn't mean that it is always harmless, right? So that's the important point. So that these things have to be kept in mind. Plus, as clinicians, we should probably invest more time in researching this, in researching why patients are attracted to this. What is the problem from our part that these people are attracted to something which is not unsubstantiated and not safe, right? So is there a flaw in maybe our way of counseling? Is there a flaw in maybe a way in which we deal with the disease? We need to introspect. These things need to be done, right? But the clear blanket answer to these patients are to say that, look, I'm not an expert in this, right? I would not give you an advice of something I'm not an expert in, right? Neither for or against, and it's up to your judgment and your call to take a decision or not, right? It's your decision, but you do it at your own risk. You don't do it, we will not advise, right?
And then prescribe the right thing.
Yeah, right, and prescribe the right thing. Always give the right advice. That's the most important.
Right. Thank you so much, Dr. Om Lakhani.
Thank you.
Thank you, everyone.